This is the Back to Health Wellness Center Subluxation Workshop for new patients or patients that are interested in learning more about what chiropractic can do for them. So the objectives for this talk are how new patients can get the very most out of their care and to shift their belief system from a disease care model to a wellness care model. And this is because rather than just treating symptoms once they occur or managing diseases, we like to try and promote health and wellness so the diseases never show up in the first place. And also for sharing this information with friends and family members to potentially improve their quality of life and potentially save their life. So what is health? Everyone probably knows who this is in the picture. It's Lance Armstrong. Everyone knows that he was one of the fittest people in the world. He has a great mental attitude, eats right, does everything you would think of that would promote the best possible health anyone can have. However, you probably also know that he developed cancer. So even though he felt good, ate well, he exercised, he still had an underlying disease condition that developed in his body. So what is health then? Health is a state of optimal physical, mental, and social well-being, not merely the absence of disease or symptoms. So one can feel great and still have an underlying disease process. On the opposite side, you could drop a brick on your foot and it would hurt like heck, however that does not mean you're not healthy. So symptoms are not always a good indicator of how your underlying health really is. So the current state of health in the country, heart disease is the #1 cause of death. According to the American Heart Association, 1 American dies of cardiovascular disease every 34 seconds. And if you look at this graph, deaths from diseases of the heart have gone up exponentially since the beginning of last century. However, if you talk to genetic researchers, our genes haven't changed in over 40,000 years. So it's not genetics that are doing this. So if not, what is it? So the progression of cardiovascular disease. Children between the ages of 2 and 15 are now showing signs of clogged arteries. 30% of adolescents 16 to 20, 50% of young adults, and 75% of adults 26 to 39 years are showing signs of clogged arteries. And it's going up every year. So the #2 cause of death is cancer. Approximately 50% of our population will be diagnosed with cancer. 1 in 4 males will die, and 1 in 5 females will die of cancer. And these rates are actually going up as well. Diabetes. Between 1996 and 2003, the number of adult diabetic patients has gone up from 9.9 million to 13.7 million. 11% of adults ages 40 to 59 and 23% of adults 60 years and older have diabetes. And it's becoming so pervasive that doctors are now finding children with adult onset diabetes, and some adults who suffer from both type 2 and type 1 diabetes, known as double diabetes. And according to the National Center for Health Statistics and the National Health Survey, a typical adult over age 18 has conditions. In less than 1 generation, the percentage of deaths due to chronic disease has exploded from 72% to 89%. So we are living longer, but we have more chronic disease, according to Amy Bernstein. So let's say technology can keep us alive till we're 100 years old. Would you prefer to be active and doing everything you would like to do, or do you want to be in a wheelchair breathing oxygen? Obviously, we'd like to be as active and do whatever we want to be if we live that long. So where does disease come from? There is one cause. Disease comes from the body's inability to adapt to stress. And this stress can be physical, chemical, or emotional. And there's also only one cure. Since the body is a self-healing, self-regulating organism, it has the ability to adapt and heal itself as long as there's no interference. This is a picture of someone with a sliver in their finger. As you may know, it could cause an infection, it can be painful, it can be swollen. So what is the cure? You could take painkillers for the pain, you could take anti-inflammatories for the inflammation, but is that going to cure the problem? The only cure is to remove the interference, which is the sliver, and the body will do the healing. So why do we have a health crisis if the body can heal itself? I'm sure you have figured this out already. It's because we have a lifestyle crisis. So once again, let's look at the 3 dimensions of stress. You can have physical stress, which could be sedentary lifestyles, could be traumas, could be poor posture. We have biochemical stresses, artificial sweeteners, caffeine, nicotine, processed foods. We have emotional stresses, money problems, anxiety, depression, unhealthy relationships. And when you're looking at your health, you have to look at all 3 dimensions of stress. So how is stress and the nervous system related? Well, we live our lives through our nervous system. All stress is filtered and processed through the nervous system. And when stress becomes chronic, or the amount significant, it can overwhelm the ability of our nervous system to adapt. This can lead to unhealthy, covert, habituated neurologic patterns. So what you should ask yourself is, how important is it to have an optimal functioning nervous system from this day forward through the rest of your life? Obviously, very important. So what controls our health? Our nervous system controls and coordinates the function of every cell, tissue, and organ in our body. There are 3 types of nerves in the body. There's sensory nerves, which control the feeling you have. There's motor nerves, which control all the muscles of your body. And there's organ nerves, or autonomic nerves. And these are the ones that control the function of all your blood vessels, glands, organs, tissues, etc. So what is a subluxation, or what causes the interference in the nervous system? Well, subluxations are unhealthy neurologic patterns which interfere with the body's ability to express itself. These subluxations create catastrophic damage to our health. They interfere with our performance in every dimension: physically, emotionally, mentally, the expression of our health, the expression of our human potential, the expression of our human spirit. They also initiate downward spirals of disease. One example would be let's say you interfere with a motor nerve, it's going to cause excess muscle contraction on one side of the body. Those muscles attach to bones, so those bones will be pulled out of alignment. And when the bones are out of alignment, it actually creates a further interference to the nervous system, which can therefore create more muscle contraction, which will create more nerve interference, and you get this vicious spiral of one thing perpetuating the other. So what is this? The thalamic neuron theory. The thalamic neuron theory postulates that the central nervous system is involved in all disease processes. So inherent in its capacity to learn and adapt, or habituate, the central nervous system's has the ability to learn to be sick, which is called pathologic habituation. And this can lead to chronic disease states. But they've also found that these disease states, or habituated neurologic states, can be reversed through manipulation or adjustments, which is what chiropractors do. So by giving a manipulation, it can interfere with this pathologic nerve pattern that has occurred to break it up so the body is better able to heal. So this theory is actually proposed to explain the causes and cures of all diseases. So subluxations are relentless and progressive in nature. There are these studies called the Winsor Autopsies that a doctor named Henry Winsor performed many years ago. His objective was actually to try and prove that there was no correlation between the nervous system interference and disease states. But what he found is the actual opposite of what he was trying to prove. He actually showed that 96.7% of all diseased organs on autopsy had interference to the nerves that controlled the function of that organ. And he also found that the worse progression of that interference, the worse the disease state. In these organs in particular, heart, lung, liver, stomach, prostate, and bladder, he actually found 100% correlation. So every single person he autopsied that had these diseases had damage to the nerves that controlled these organs. And he could tell that it was the nerve damage that controlled the organs by the amount of degeneration around the spine or the amount of disease in the organs, and he knew which one would have started first. So his conclusions were irritation near the origin of the sympathetic nerve or autonomic nerve will cause functional or organic changes in the organ supplied by that portion of the sympathetic nerve. In other words, if you have damage to the sympathetic nerves coming from your spine, you will get damage to those organs that are supplied by that nerve. It's just a matter of time. Another study on lung disease revealed that 42 out of 42 patients with pulmonary disease or lung disease showed evidence of irritation of those nerves from T2 through T7, and those are the nerves that control the lung function. Same thing with bladder disease. Found that irritation of L5, which controls the bladder, can cause dysfunction of the bladder. Immune function. Researchers showed that the immune system is under direct control of the nervous system, and they summarized that subluxations can negatively affect the body's immune response. In the case of heart disease, same thing. The nerves that control the heart, if they are interfered with or not functioning properly, it will cause abnormal heart beating or contractions. So what are the signs and symptoms of subluxations? You could probably be thinking about pain, muscle contraction. However, the nerves that are interfered with are not sensory nerves. You may not actually feel anything. So how can you tell when you or your family are subluxated? The only way to know for sure is to have your nervous system checked by a wellness chiropractor. And through this examination, your proprioceptive nerves will be checked, your motor nerves, autonomic nerves, and your central nerve system. In our office at the Back to Health Wellness Center, we have technology called the Insight Subluxation Station. It's actually the only technology of its kind that's certified by the Space Foundation. One of the tests we do is a motor nerve assessment, and this one measures the function of the nerves that control the muscles. And we have an autonomic nerve assessment, which measures the function of the nerves that control the organs, glands, and blood vessels. And we have a test that measures your body's ability to adapt to stress. It can show the balance between your sympathetic and parasympathetic nervous system and the overall activity of your autonomic nervous system. We also use these tests to measure progress with patient care to see if what we're doing is actually helping improve the function. So are subluxations reversible? Absolutely. And here are some studies showing this. In a study with ulcer patients, 11 ulcer patients received chiropractic care, and they were compared to 24 cases treated medically. The chiropractic group experienced remission, which was demonstrated endoscopically on an average of 10 days earlier than those with traditional care. 75 individuals with high blood pressure received chiropractic adjustments, and they found that both systolic and diastolic blood pressures decreased significantly in the adjusted group, and there were no significant changes in the controlled group. And they also noted that those in the adjusted group with the highest blood pressure showed the most dramatic reduction. In a study on immune function, over a 6-month period of time, HIV-positive patients experienced a 48% increase in their CD4 cell counts under chiropractic care, and the control group experienced almost an 8% decline in their CD4 counts. Another study, some cancer researcher, found that the immune system of individuals treated with chiropractic care had a 200 to 400% improvement in the immune response compared to those who did not receive chiropractic care. In ear infections, 332 children who suffered with ear infections received chiropractic adjustments, and they found a strong correlation between resolution with the adjustments. Personally, I have treated many children who were actually scheduled for tubes in their ears, and the surgeries were canceled because of resolution with the chiropractic treatment. And obviously, chiropractors do not treat any of these disease conditions specifically. What we do is just treat the body, improve the body's function, and then the body is able to heal itself. In a study on high cholesterol, 10 students were monitored, and they found all 10 cases reported marked reductions in all cardiac risk factors during the study. This is a study on the first HMO in the US. It was actually in Illinois that started using chiropractors as primary care physicians. They found that just after 2 years of utilizing chiropractors, hospitalizations were reduced by 80%, outpatient surgeries were reduced by 85%, and prescription drug use was reduced by 56%. And what I don't quite understand is why they did not keep using the chiropractors as the primary care physicians. It's possible that money or politics had something to do with that. Here's a sample case study of a lady named Debbie. She was 40 years old and had her first diagnosis of indigestion and then asthma, and her condition kept getting worse, and she was admitted to the ER 3 times. She was put on daily doses of 9 different medications, and the MDs, because of her decline, actually gave her 6 months to live. So these are some nerve scans of Debbie. The very top was when she first came in, and on these scans colors are bad, white is good. So you can see on the top she had significant nerve interference going on. After 1 month, as you can see, it was significantly reduced. And then after 2 months, her nerve scans looked very good. And by the first re-exam, she was off most of her medication, and she feels that chiropractic saved her life, and it most likely did. So I'd encourage you to share this information with your friends and family in hopes that we can prevent the decline in health that's going on in the United States as it is. And anyone who is not currently a patient, by watching this video, if you call up and mention that you've seen it, you will be eligible for a complimentary consultation to see if chiropractic can help you improve your quality of life.